Hello, I'm Florencia Luna, and I'm very happy and honored to be able to participate in this extremely interesting symposium and to be able to do some comments to the work of my fellow colleagues. Let me start by acknowledging the importance and the relevance of REACH project. The work that has been done, which has been done in different countries, in different settings, different kinds of research involved, but also different groups that traditionally are considered vulnerable. In Kenya, in South Africa, in Thailand, with children and mothers, with young girls, with migrant pregnant women. I think this is extremely interesting, but I also think it's very interesting in order to see how this empirical data may improve our conceptual framework. So I think that in this other sense, this is a very thought-provoking and interesting and relevant project. So what does this REACH project says about vulnerability? Does the empirical work copes with or fits the conceptual analysis? In my first article regarding vulnerability, in elucidating the concept of vulnerability, layers, not labels, I say there are several layers of vulnerability. I say they are multiple and different, some related to the lack of consent, to socioeconomic conditions, age, gender, the context. I also say layers may coexist. They may be intersectional. They can be minimized one by one. And I say there is not a layer or condition that may exhaust the category. So can we really speak of layers of vulnerabilities or something in that sense? Let's look to Peg Young table, where she says, and this is very interesting, that there are not only migrants, but there are at least three kinds of migrant groups, that there are language issues, that there's instability, that there are literacy issue, problems regarding income and instability, mobility issues, health problems. So if we remember what this study is saying, we can see that there are different layers overlapping. So if we remember our initial question, we can see that it seems that we definitely face different layers of vulnerability, that they do overlap and render the person more and more vulnerable. So this empirical data seem to resonate perfectly well with my own theoretical account on vulnerability. So this had to do with how we conceptualize this concept, its theoretical way of thinking it, how it operates and how we find it in the reality. But how can we think vulnerabilities in practical terms? This is the second part of what I've been working, and I wrote an article 2 years ago identifying and evaluating layers of vulnerability, where I try to go further. And I propose to consider some relevant distinctions of layers, some that were already introduced by Rogers et al., that I think can play a very important role and that I reformulate. And I also present a process of identification and evaluation of layers in order to think relevant obligations through the provision of protection, safeguards, and empowerment. There are two relevant distinctions I want to explain. The first one is this idea that there are layers that have a cascading effect, or cascade layers. These are layers that may exacerbate existing vulnerabilities or generate new vulnerabilities. And in this sense, they are quite harmful. The second one is the idea that layers of vulnerabilities are disposition. This is a philosophical concept. And the idea, or an example, is, for example, a cube of sugar. A cube of sugar has a dispositional character. It can be soluble when it's inserted in a liquid. If that doesn't happen, it will remain solid. So, dispositions are, in a way, latent until a stimulus condition triggers them. If those stimulus conditions or triggers do not happen, that disposition will never be actual. So, both distinctions are very relevant because they may help us identify very crucial elements in our analysis. This table shows the evaluation process and how these concepts interact. So what we have to do, or what we try to do, is prioritize and evaluate those different layers that are present, and we don't know exactly which are more important, which we should try to eradicate or minimize. So what I propose is that we work from the more harmful to the less harmful. And in this sense, cascade vulnerabilities or vulnerabilities with this cascade effect are normally very harmful. That's why we have to consider them. Then we have to consider if there are other layers that are very harmful, but maybe do not have this cascading effect, or if they are very probable to. And what we have to do is to identify these layers, but mostly identify their stimulus conditions or triggers, if they are there, and if they may make that vulnerability in something actual, in an actual harm. And once we have these ideas, we have to begin thinking what are our obligations. The first one is avoiding exacerbating layers. So that's basic. Our research should not exacerbate any layer more than the ones that already are there. We have to try to eradicate layers, but this might be very difficult. So sometimes what we will end doing is minimizing layers. And we can do this through different strategies: protection, safeguards, empowerment. And as we saw this project, in all these projects, agency and empowerment is really important. And this is part of the picture. If we go back to Baekhyun's slide, we can see the different types of vulnerabilities that are there. And we can see how the political vulnerability will trigger other layers. For example, how we are seeing that there is no legal status, there's lack of security, lack of protection, lack of documentation that may trigger, for example, lack of social insurance and things that follow. We see the economic vulnerabilities that lack of resources, lack of wage, but also this lack of social security or the possibility of circulating. And at the same time, some of them will trigger, for example, social vulnerabilities like lack of education, illiteracy, or domestic violence that may trigger other vulnerabilities: discrimination, drug and alcohol abuse. So we think, so we see all these different types of vulnerabilities, these different layers that may interact, that may have this intersectional impact, making and rendering the person more and more vulnerable. What can we see then? Well, it seems this practical evaluation, this empirical data fit with the key concepts and with the conceptual framework I was proposing. So, can we identify cascade layers? It seems we can. In the Thai border, the political disenfranchisement may function as a cascade layers, but as we saw, there are many other cascade layers over there. Can we identify triggers or stimulus conditions, triggers we should not put in motion? Well, we see that there are, for example, in the South African study, male carers may be triggers, but information might also function as a trigger, so it should be very carefully kept. And we can find other triggers that we should avoid putting in motion. Can we find obligations? Yes. And for example, we have seen, for example, in the Thai case, that an issue to do is prevent non-necessary visit to avoid exacerbating layers or triggering new ones. For example, in rainy season, it may be quite dangerous for these pregnant women to go to the clinic. And we have seen also the importance of agency and protection. So we see that there are many issues that are being considered and are part of our intellectual, conceptual framework that are there in the practice. Thus, to finish this presentation, I should say that not only from my theoretical and practical account, these findings seems to resonate and be coherent to what I was thinking, but I think that there are further ideas that are worth thinking through and exploring. For example, I found most interesting to think about the moral distress by frontline staff, to think in the hidden burden of research itself. This is quite interesting because normally what we hear is, well, there's no burden, and sometimes it's really beneficial. But here we see that there are certain hidden burdens that are so linked to vulnerability that we should try to see how to identify them. Another very interesting issue that came out in these presentations, I think it's this idea of a constrained agency and how to work with it, and also how there still is agency and the wish of being empowered, and the importance of empowering. So that's why, for example, I think that when we are thinking in vulnerabilities, we should think in safeguard and protections, but we should also think, very importantly, in empowerment, in helping these persons to get rid of and to handle the situation. The importance of considering non-medical needs in these kind of situations. And very importantly, the role of research ethics committees in order to be able to see all these like fine grain analysis, all these details and all these nuances that are needed in order to do good research. So I really think these projects opens to a very interesting and thought-provoking analysis, and that we should continue working on it. I hope it is a pity we are not together sitting now and being able to discuss and ask questions. I think it's terribly interesting, all the material, and I thank a lot Maureen, Kelly, but all the team for letting me share all their experience in this project. Thank you very much.